Hello, everyone. A very good morning to all of you. I'm Sayukta from Radiance with You YouTube channel, and I'm sure all of you must be keeping good health. Today, we are talking about a skin condition which draws everyone's attention even when there is a tiny spot. Yes, that's vitiligo. Vitiligo manifests as depigmented patches with a convex border without signs of inflammation, with normal skin around. Macules are milky white in color, well demarcated with either round, oval, or linear in shape. We are going to have an important chat about them and how we can stop them from spreading by taking action early. Vitiligo is a long-term skin condition that causes patches of skin to lose their pigment or color. This happens because the pigment-producing cells in the skin, called melanocytes, are either destroyed or stop functioning. But don't worry, we are not just here to talk about the problem, we are here to talk about what we can do about it. We'll look at how to stop vitiligo from happening and talk about the latest treatment options available. So let's connect today with our skin expert, Dr. Fathimath Rubeena, who is M.B.B.S, M.D. DBL dermatologist, joining live from Kasaragod to talk about vitiligo myths and facts. Dr. Fathimath Rubeena, with nearly a decade of experience and offering world-class dermatological care to all her patients suffering from various skin diseases. It's She is truly a patient focused dermatologist. It is a pleasure to have you with us today, Dr. Fatima Rubina. Very warm welcome to you.
Thank you so much. I thank you for inviting me for this session on this World Vitiligo Day. I'm happy to be the part of this session on this day. As a treating dermatologist who is dealing with many patients with vitiligo, it is a way that creating awareness is a way to dispel the myths and misunderstanding, damaging myths and misunderstandings surrounding this visible skin disease.
Absolutely, Doctor. And what a better way to talk, what a better day to talk about it, which is a World Vitiligo Day, as you said. So today, as we are talking about vitiligo to start with, we will try to understand what is it, Doctor.
Okay, vitiligo is a skin disease. It is characterized by depigmentation of the skin. Depigmentation means loss of skin color. It is an autoimmune disease. It is a non-fatal disease. It does affect the skin surface. It has a world prevalence of just 1%. It is a rare disease, but the social stigma attached to this disease has caused this mental disability to the patient more than the physical appearance. Hence, creating awareness is very important regarding this disease. So the patient usually present with a white patch over the skin, and the hair over the area will also lose the color and it will appear white in color. So mainly it is an autoimmune disease.
Okay, Doctor. What causes it? What causes vitiligo?
Okay, there are many theories related to the cause of the disease. Mainly, it is an autoimmune disease. So, what is autoimmune disease? The body's self-immune system mistakenly attack the melanocytes of the skin. That is, melanocytes are the melanin producing cells. Melanin are the pigments that gives color to the skin. So, based on the amount of melanin present in your skin, there will be various shades of color to the people around the world. So, in a vitiligo patient, over the vitiligo patch, the melanin will be absent. This may be due to the destruction of melanocytes, or the melanocytes will be absent in that area. So, this causes the vitiligo. Uh, Along with that, there are various triggering factors that leads to the development of vitiligo, like stress, chemical exposure, hormonal, that it can appear during the pubertal surge or something like that. So it is important to know the triggering factors too.
Right. And Doctor, how is vitiligo diagnosed?
So a dermatologist can diagnose vitiligo with by complete physical examination of the patient and from the medical history. So by examining the patient, the dermatologist can identify the lesion. There are different morphological types like trichrome vitiligo, pentachrome vitiligo, blue vitiligo, inflammatory vitiligo. So by examining, the doctor will be able to diagnose the disease. In addition to this, Woods lamp can be used. That is, Woods lamp is a handheld lamp that emits UV light. So when we see the patch through the Woods lamp, it will appear more white, milky white, and it will be more prominent. So it aids to the diagnosis. Then to confirm, we may need a biopsy, and the treating dermatologist will also ask for some blood tests. It is not to diagnose a vitiligo, but since the vitiligo is an autoimmune disease, there will be the possibility of other autoimmune disease with the patient, in the patient, like thyroid disease, rheumatoid arthritis, and so it is very important to rule out this disease in patient.
Right. Now, doctor, does it, happen overnight, or do they, spread gradually? So, what are the symptoms, signs of vitiligo?
Okay, the patient will have only the white patch over the body, or may present with graying of the hair, if the vitiligo patch is in the scalp. So the only presenting symptom is discoloration of the skin. It is not associated with any itching, pain, or any other symptoms. So the patient will present only with the only for the cosmetic concern, but more more than discomfort, they are aware of the cosmetic concern of the disease. So it can't spread. It can spread over days, but it is not in equal rate in all the patients. Like in few, it may spread rapidly. Like after appearance of one or two patches, it may spread to all other parts of the body within months. But in few patients, it can stay stable. Like after appearance of one or two patches, it will stay safe for many years. So the rate of spread and the rate of progression of the disease also depends on the patients.
Okay. It can happen anywhere on the body or scalp,
Yeah,
anywhere.
it's not only present in the exposed part of the body, it can appear in any part of the body. It can involve any skin, any areas, then also affect the scalp.
Mhm. Okay. Now, doctor, because this is something that we are trying to spread awareness, on, and today is World Vitiligo Day, so it becomes even more important to spread awareness. Now, do these vitiligo patches, they can get larger also in size? I mean, they are spreading.
Yeah.
So if we see one spot, we can end up seeing more spots, and that spot can also become large.
Yeah, like initially, the patient may notice a small spot, like 1 to 2 centimeter or less than that, but gradually that can progress to involve large extent of the body. Maybe in few patients it can stay safe. So it varies with the person, and also the triggering factor. Like if the patch is stable for many years, and if there is some triggering factors like trauma or emotional or physical stress, this can lead to the sudden activation of the disease, and then can spread and involve the other areas. And we are also, if the disease is so active, we can control the disease with medication.
Okay. Now, how important it is, doctor, to go and consult a qualified dermat, who is the right person to, take advice from, as soon as we see these spots.
Yeah, obviously the right person to visit is a dermatologist, because all the white patches on the skin are not vitiligo. It is a misconcept prevailing in the society. So the patient will be worried while seeing a white patch, saying that is vitiligo. So first we have to understand that all the white patches are not vitiligo. There are many diseases that present with white patches over the skin. For example, few like tinea versicolor, that is a fungal infection. Then pityriasis versicolor, that is most commonly seen in children with white patches over the face. It is like a normal eczema. Then leprosy, then can present as post-inflammatory hypopigmentation, idiopathic guttate hypomelanosis. There are various other diseases present as white patches. So first thing is to diagnose the disease. So dermatologist is the qualified person who can diagnose the disease even by the physical examination itself. So there are some tests like Woods lamp examination and biopsy to confirm if it is doubtful.
Right. And then what are the treatment options available, doctor?
Yeah, there are so many treatment options available. Like there is no one best treatment for vitiligo. Since there are many treatments options available, the dermatologist will decide the best treatment for the patient. It can be assessed by considering various aspects like age of the patient, general physical health of the patient, and how much morbidity is causing to the patient, and does he actually need the treatment. Like there are many patients who embrace their skin with vitiligo patches, who is not actually concerned about treatment. But if it is causing discomfort, if it is like in the visible areas like face, there are treatment options. So dermatologists decide the treatment by setting few goals in mind. That is, first, to control the disease process, so to stop the spreading of the patch or to stop the development of new patch. That is the first goal of the treatment. And once the disease has stopped, we call it a stable vitiligo, that the lesion is stable. It has not progressed or increased in size since last 12 months, or there is no appearance of any new patches since last 12 months. And once the vitiligo is stable, the treatment plan is aimed at causing repigmentation of the present patch. So next we will aim for repigmentation. So treatment options include application of topical medications like if the patch is small and if the patient is responding, we can control it with the topical medications only. And there are also some oral drugs which may have to be started, like most of immunosuppressant drugs. And after this, for repigmentation, if the patient is very stubborn, the lesion is very stubborn, and if it's not responding to the oral and topical medication, we can go for vitiligo surgeries. It is the best option if the treatment is stable. It causes repigmentation of the lesions. So there is phototherapy too. We can give option to the patient for phototherapy, where NB-UVB light will be exposed to that area. But it is a long process. The patient have to go multiple session. We this vitiligo surgery is the best option if the lesion is stable. That is, it can be a skin graft or melanocyte graft. Skin graft means a healthy pigmented skin will be taken from the patient and it will be placed over the patch, and the repigmentation occur within 6 months. The repigmentation can occur. And in melanocyte graft, after taking the healthy normal pigmented skin, melanocytes will be separated from that skin through various enzymes and various process, and these melanocytes will be transferred to the vitiligo patch. This patch will take the melanocytes and will start pigmenting.
Mhm. To the surgery that you just talked about, is it safe, or because it sounds like a very big surgery, because you are taking some, it's the grafting, you are taking out a good skin and then putting it there. So how safe it is, how pocket friendly
Yeah,
it is?
this
I mean,
surgery,
that
as
really
it
good to
sounds
hear.
like surgery, it is not a very big procedure. It is a simple procedure. It is an OPD. You can do it as an OPD procedure. The patient can
Okay.
come and do the procedure, and he can go back to on the same day. It is like an office procedure. It will take few hours, but aftercare is needed. Like you should keep the area stable. We have transplanted just a layer of skin or few melanocyte cells, so it is important that it should be in place. That is the care that patient has to take. Then after few days, that transplant will scab off and it will fall off. But the melanocytes, that is the pigment producing cells, will be taken up by the area over the patch. So that will start to divide, multiply, and it will start to produce pigmentation. So as it sounds, it is not a very tedious procedure or something. Everyone who is having stable procedure, I will suggest it is the best option because especially in the exposed areas like face, lips, and all, lip vitiligo and all, it is very stubborn, and does not respond well to the treatment. So once it is stable, this vitiligo surgery is a very good option.
Okay. And doctor, are vitiligo patients photosensitive when they go out in sun? Is it going to the sun rays, the heat going to affect them more?
Yeah, like the what is the function of melanin in our body? The function of melanin is mainly, there are many functions, that one is main sun protection. So it protects the skin from the UV rays. So since the melanin and melanocytes are absent in those area, there is more prone for sun damage. So it is very important to take the sun protection, to wear sunscreen. The patient with vitiligo must take the sun protection. And one more important point is, while they are having more sun exposure, the normal skin will go darker, so the vitiligo patch will appear more prominent. That is also very disturbing for the patient. As the normal skin pigmentation increases, there is no much change will occur over the vitiligo patches, and thus the vitiligo lesions will be more noticeable. So it is important to protect the normal skin too.
And those who have vitiligo, any skincare routine that they need to follow religiously?
Yeah, like any normal skincare routine, they have to follow, like moisturize the skin, sun protection, and if they are on treatment, take regular medications properly.
Okay. We are getting so many questions from our viewers as well. I'll take them one by one. But before that, doctor, is vitiligo genetic? Anything to do with the family history?
Yeah, vitiligo has genetic component. Though vitiligo has genetic component, it does not always spread appears in all the generation. So, if you are having a very close blood relative with vitiligo, there is chance you can develop vitiligo, and that it is not must that you will be developing vitiligo. So, it does not appear in every generation, but yes, it is having genetic component. And if you are a genetic prone individual, when they are getting exposed to these triggering factors like stress, trauma, hormonal imbalance, and some chemicals like phenols, there is more chance to develop vitiligo than the normal individual.
Okay. Now, for example, there is a family history, and now the person is trying to prevent it. What preventive strategy taken?
Yeah, that if the person is having a very close relative with vitiligo, there is no test, or we cannot predict whether this patient will develop vitiligo in future. So prevention method he can take us to avoid trauma, can because trauma can damage the melanocytes. So there is chance of developing the patches. He should avoid trauma, especially tattooing of the skin. It's very important. You should avoid the tattooing. Then more chronic sun exposure, stress, physical and emotional stress will activate the immune system. So that can also trigger to the development of the disease, and exposure to the chemicals such as um, phenols, etc., is also important.
Absolutely. Doctor, there are so many questions, and one of our viewers have asked that does stress cause vitiligo?
Yeah, stress has a component. Stress is a triggering component, but not in everyone. Like a normal person, if he is exposed to so much stress, he may not develop vitiligo. If he has a genetic component of developing vitiligo, the stress can lead to development of the lesion. Like emotional and physical stress will activate the immune system. So, if the patient is genetically susceptible to vitiligo, this can be a trigger to development of the lesion. And in already a patient with vitiligo, stress can lead to development of new patches, exacerbation of the disease, that is spreading of the lesion. So, it's important to maintain the.
Right. Doctor, any myths associated with the vitiligo? I'm sure you get a lot of patients who tell that the people are afraid they'll get vitiligo from as etc. So, what are
Yeah,
some
there
of
are
the
lots and
common?
lots of myths prevailing with vitiligo, and even now in this modern era with educated people, it's very difficult to convince a patient that vitiligo is just a disease of color. Nothing, it does not affect the health of the patient. The person with vitiligo will be normal, healthy, vibrant person like any other person. The only disease is present over the skin. It's very difficult to convince a patient, and there are many myths. One is like influence of certain food, like mixing up of certain foods, like milk and fish, etc. The vitiligo has no connection with your food choices. It does not affect the disease is not affected by any of your food choices, so it is a myth. Then some people think that the vitiligo patient is having parents of the mixed race. It is nothing to do with your race or ethnicity, because they were born as normal skin. They have even toned skin. The babies were born as even toned skin, and they gradually develop vitiligo over the years. Then more is like it will be present only on the exposed part. No, vitiligo can affect any part of the body. Then vitiligo is not contagious. You can touch the lesion. It cannot spread from one person to other. It's a totally autoimmune disease. The defect is within your immune system, so it cannot be spread by contact.
Right. We have Abhishek with us, a viewer of ours, and his question is: Doctor, can vitiligo turn into skin cancer?
There is less chance of developing skin cancer from vitiligo lesion, but they are more exposed. If they are more exposed to sun, like any other skin diseases, there is chance of development of skin cancer due to excessive sun exposure. And also there is association, like if the patient is having some sort of skin cancers like melanoma or other lymphomas, there is a chance of developing vitiligo patches in that patients.
Okay. But otherwise, I mean, in
Because
general,
vitiligo will not get converted into skin cancer. It is not a cancerous disease. It is not a contagious disease. It is not an infectious disease.
right. Is it curable, doctor? Can vitiligo be cured permanently?
Yeah, that is very important. Like we cannot cure vitiligo permanently. Like we can't tell the patient you will never get a patch in your life, but we can control the disease. We can manage and we can treat the disease. So,
As
as
in
I told you,
therapy, they also need to go through what the doctor have advised once it's treated.
yeah, as I told you earlier, there are many treatment options where we can control the disease very well and can prevent from progressing the lesion and from developing new patches. And also, there are treatment options for causing repigmentation, and we can treat the area very well. But a complete cure is still not there. There is high chance of recurrence. The patient, if we are cured very well, he may develop new lesions later in life, or some patients will get a complete cure.
Okay. We have Shreya with us. Her question is: Can vitiligo go away on its own?
If the immune depends on the patient's immunity, it can go. If like very small lesions, if it may repigment gradually over time, but mostly the patches are very stubborn. It may repigment by itself.
Right. Bittu is here. Question is vitiligo painful?
No, there is no symptoms associated with vitiligo. It's just the disturbance in your skin color. There is no pain, itching, or any sort of disturbance.
Ranu is here. Her question is: Can makeup worsen vitiligo?
Can? Sorry?
Makeup.
No, the makeup does not influence the vitiligo. Like there are patients who conceal the area. Like if they are not willing for the treatment, they don't want to treat, and they have very small patches. They can conceal the area with skin makeups, and like matching for their skin tone, they can conceal the area with skin. makeups.
That is okay. That is not going to
That
worsen
is
your.
totally fine.
Okay. Meenakshi is here, and her question is, how can someone with vitiligo protect their skin from the sun?
Yeah, like any other person, vitiligo is persons also need to protect the skin, but they should be more conscious as their skin is lack of melanin, which actually protect us from some sun. So they are more prone to sun damages. So to use broad spectrum sunscreen with SPF 50 plus, then other means also they need to use, like use of wide brim hats, protective clothings, using shades, etc. It is very important. Apart from using sunscreen, um, other physical methods of sun protection is also important, and it's important to reapply the sunscreen every 2 to 3 hours.
Because we are talking about sunscreen, and we know that, especially with vitiligo people, sunscreen is very important. We would like you to shed some more light over how to use sunscreen, when to reapply, how much amount to take, etc.
Yeah, first of all, you should choose a good sunscreen. That is, various types of sunscreens are available in market. You can use a broad spectrum sunscreen that mainly physical. There are physical and chemical sunscreen. So broad spectrum sunscreen is very important. That contain SPF factor of at least 50 plus. Then the amount of sunscreen is also important. If you are choosing to cover the face and neck, 2 finger breadths of sunscreen need to be applied. And if you are staying in sun for a long time, if you are sweating, you need to reapply it frequently. So in a normal person, it is you need to reapply every 2 to 3 hours. Then it should be reapplied after a shower or after swimming, or if you are excessive sweating, to reapply it more frequently.
But doctor, who all are at risk of having vitiligo? I mean, genetic is one thing, genetic factor is one thing. What are the other risk factors?
Genetic factor is the main risk factor for development of disease. Other, there is no, like if there is no genetic trigger, there is no much other risk factor. But in patient with genetic factor, you need to avoid of this triggering factors I have mentioned: stress, some few chemical exposures, hormonal. Like if the patient is already having a genetic component, and he may develop the vitiligo patches during puberty, or during just before the pregnancy or menopause. These are the hormonal factors.
So hormonal changes or hormonal imbalance
Yeah,
also.
that act as a triggering factor, but mainly in the genetic predisposed individuals only.
Right. Now, all the people who are watching this session, who are participating in this session, what would you like to tell them, doctor? How to take care of your skin in general, and what to do in case you see, small spots, depigmented things? Because as a layman, we may not know that what's happening on our skin is vitiligo. But yeah, it may look like a depigmentation thing for us. So, how to take care of our skin and what to do in case something is wrong.
Okay. First thing, when you see a patch, don't panic. Not all white patches are vitiligo. So you can consult a qualified dermatologist and confirm the disease. So for even for the dermatologist, after confirmation of the disease, what is most important is to normalize the disease, as it is just a disease of skin color, and it does not affect the health of the patient, and it is completely the body of the body is completely healthy. We should able to counsel the patient regarding that. So just go to the dermatologist and confirm the disease. And later, there are various treatment options available. You can discuss with your dermatologist which treatment will suit you. Because this treatment is, it will take a long time. We will need to be in follow up and continue the treatment for a longer period. So which treatment actually suits you without affecting your daily activities, you have to choose that. Like If you are going for phototherapy, you will have to go to the center every 2 to 3 weeks for taking the phototherapy. In some patients it will be very difficult. So there are other options if it is difficult. So it is best to choose the treatment plan by discussing with your dermatologist. And then if the lesion is in non-exposed part of the body, and if it is stable, it's not anyway, it will not cause any much discomfort to the patient. It is just on the cosmetic concern. It's not important to take treatment. If
Okay.
you are fine and the lesion is not spreading, it's not important to take treatment for that lesion. You can use the method like covering it with the makeup. And even we have model like Winnie Harlow, who is also having vitiligo. She let the world see her skin as it is, and she's embracing her skin. It is also totally normal.
Absolutely. And doctor, because we have this tendency of doing some home remedy in case of any, issue related with skin, or we have this obsession of going to the chemist shop nearby and go for some over-the-counter topical application. Then there are so many influencers on various social media platforms who have so many quick fixes for various issues, especially for skin-related problems. Now, why it is important to not fall for these home remedies or over-the-counter topical applications, or going by what the influencers are telling you, and go to a qualified dermat in case, especially if you have signs of.
Yeah, first thing you need to understand about this is these people who are giving advice in social media, they are not the qualified skin experts. They don't know what is skin. They just try few remedies on their skin, and it may work on them, and they just give the advice. There is no scientific base behind that. So what is most important is not every skin are same. So one treatment that is suited for a person, it will not always be effective on other. And for a treatment, all the skin will not respond in the same way. The most common patient we encounter in daily OP is that they come with the side effects of this treatment. They will be seeing in social media and applying some products directly from the chemist, and they get burns and irritations over the skin, and they come for the treatment. So best thing is, it is difficult to identify what chooses for the skin. To decide that, the skin expert, that is dermatologist, is the qualified person. So you need to understand that first. And all skins are not same. It is the most important thing you need to understand.
Absolutely. And doctor, before we sum up the whole session, any take-home message for our viewers?
Yeah, in this day of World Vitiligo Day, what advice I have to give is that every color is beautiful. Every shades of skin are beautiful. Don't let the amount of melanin in your skin dictate your life. Love to embrace your skin.
Absolutely. It's important to love ourselves, to love whatever is there.
Love the skin you are in. Every shade has its beauty.
Absolutely. I completely agree to that. And in case you have problems, then you have doctors, you have qualified dermatologists, you can go and approach them, but going to the right person is really
Yeah, definitely. That is more important.
important. Yes. Thank you so very much, Dr. Fathimath Rubeena. It was wonderful talking to you. Thank you for your valuable time and making this session so interesting.
Thank you. Thank you so much.
And viewers, thank you for joining us. Stay connected. This is issued in public interest by makers of Luribor Lotion Advanced Gen X division of Hetero Healthcare. And stay connected with us. Do not forget to subscribe our channel, Radiance